Well, good afternoon or good evening or good morning, or depending on what time zone and what part of the country you are watching today's special edition of the Healthcare Leadership Show with Marion Spears Carr. That's me. Thank you for joining us. And today is an exciting time for me. It's something we've been waiting to talk to the audience about for quite a while. And the topic is from the C-suite to the frontline, CalleoHealth and Inflow executives. And that's our two companies that have created a strategic relationship or strategic partnership because we serve the same communities in the healthcare space. And we feel like that there's going to be tremendous value, not only from a perspective of what we can bring to the table as a collective group, but for our clients, more importantly, have a relationship with two organizations who are tied together in order to make the biggest difference for them. And today, my audience, I'd like to introduce those on the show. Dr. Jonathan Ringo, he is the chairman of the board of CalleoHealth, and in a moment, I'm going to let him give you a little bit more about his background, incredible background. And then my friend and longtime friend now, Avi Rosenwing. Avi, so glad to have you. You're the president CEO of this organization. You and I met at an ACHE conference a long time ago, it seems like. Dr. Ringo, I'm so glad to have you on the call. And I'm just going to hand it off to you, Avi. I'd love for you to introduce yourself, and maybe you can introduce Dr. Ringo. And what we're going to talk about, for those of you watching live, let us know in the comments, or if you watch the replay, let us know in the comments. What we're going to be talking about is not just about our companies and why we've done this, but more importantly, we're going to talk about what the market looks like. We're going to talk about why we felt like it was so important for us to have this relationship so we can better serve the people we work with. Avi, good to see you, man. Glad to have you. And Dr. Ringo, thank you for being on the show.
Thank you so much. Dr. Ringo, you want to kick it off?
Sure. Thank you, Marion. It's a pleasure to be here. Thank you for this opportunity. And as you said, we are really excited about the potential that this brings with organizations working together. A little bit about myself, and then I'll hand it off to Avi. So I'm a physician by background. I did my residency training in obstetrics and gynecology at Sinai Hospital in Baltimore, and then went to work for Northwell Health up in New York. Had a number of different roles there, primarily focusing around population health and informatics. And then went back to Sinai, which is part of LifeBridge Health in Baltimore, to take over the role of the system's first CMIO. And then went to have additional responsibilities in clinical transformation. So really looking at that opportunity to take technology and help clinicians perform at the top of their license, perform more efficiently, more effectively for their patients, at the same time give those working with the physicians a real insight into how they could provide higher quality healthcare because of the technology that was available. Soon after that, became president of Sinai Hospital, a role I had for a number of years, which was a really incredible opportunity to see, healthcare delivery up close and personal. Throughout that time, I continued to practice clinically as an OB, which is something that I enjoy. And about 5 years ago, left Sinai to pursue a number of different opportunities, and was fortunate enough to connect with Avi, who I'd met during my time at LifeBridge on CalleoHealth. And I'll hand it off to Avi. He can tell you about his background and some of the work we're doing with Calleo.
Thank you very much, Dr. Ringo. Marion, always a pleasure. Without all the wonderful details, Calleo has really been focused for a bunch of years on trying to bring new technologies into the healthcare space, specifically driven and designed by improving both clinical outcomes and financial outcomes. And along the path that we've taken, really led by Dr. Ringo's vision coming from a value-based care space, is we look at pain points within healthcare systems, whether it's practices or hospitals or SNFs, and we try to identify opportunities where we can really add substantial value. We learned along the way that among the major challenges consistently is that staffing piece. It's not only how do I find the right person at the right time, it's how do I find the person that fits our culture, our needs, that can work within our staff, that can fulfill the need, that space, the gap that we currently have, not just from a clinical or management position, but really from a cultural position of being able to provide just the best care that the system can for their patients. So with that, we started looking initially at skilled nursing facilities. We expanded beyond that to medical practices to healthcare systems. And Marion, of course, knowing you for a long time, we realized the opportunity we really are hand in glove. We fit perfectly because we don't focus on that senior management, but that senior management role is so critical in defining what the culture is, and then finding that those lower managers or the clinicians or even just the general staff people were able to fit into the culture of the healthcare system. It just became an obvious fit for us.
Yeah, and when you approached me about this idea, we were talking about a different project that you were on, and when we got to talking about what I had launched, and for those of you who don't know me, my background is real briefly. I've been in the executive search and leadership development space for 35 years. Kind of I don't know if I'm a serial startup guy, but I've started up a couple firms. And this new iteration, Inflow Executives, is a firm that I launched 3 years ago. And our whole goal with Inflow Executives was to build these type of strategic partnerships, strategic relationships where we're more than just a one-off vendor for our clients. And when you approached me, when you and I started talking about it, it made so much sense for us to be connected to each other, so that when we walk into an organization, be it on my side of the house or your side of the house, that we can solve problems from the front line, which is such a critical challenge. I want to get into that in a minute. With like what being line and frontline staffing and why it's so critical to have the right partner all the way to the C-suite, as we say. But the whole goal for everyone listening is we're here to change the model of what that would look like. Rather than having multiple vendors, multiple relationships with various degrees of performance, by working with this relationship, our goal was, one, to solve those problems across the enterprise. And secondly, and more importantly, develop a relationship where we are your valued partner, your trusted partner. And so that's the whole goal. So for the audience, I would love for you guys to talk about, Dr. Ringo or Avi or both, what was the problem that you were trying to solve when you said you've been in the technology space, you've been solving problems, particularly on the value-based care side of the house, and when you moved into the staffing space, what was that gap that you said we can fill, the problem you could solve? Maybe talk a little bit about that, because for me, my perspective, that's the big differentiator for CalleoHealth is y'all are solving a problem that's a little bit different and from a different perspective than the other staffing firms that are out in the marketplace.
You want me to take this, Avi?
Please.
Yeah, okay. It's the thing. So I think it's a couple of different things. Number one, it's really looking at what is the right match between the candidate and the position. In other words, at certain levels of position within healthcare, especially if you're looking at positions that might currently have a frequent turnover, whether it's a position like a medical assistant or an LPN or a GNA, those level of positions, it's a significant recruiting challenge because a lot of people aren't always looking for positions like that as a lifelong career, but they see it as a stepping stone, or they see it because they don't really see a lot of other opportunity. So it's trying to help the health system in two ways. One, identifying candidates that have a higher likelihood of staying there for longer and being an appropriate fit for the organization. Two, it's helping organizations develop a ladder so that you get the benefit from having someone there, but they can move up the ladder in your own organization. It's looking to identify the right people, match the organization, and using the most up-to-date analytics, predictive learning capabilities to really get the right person there. Now, a lot of times there'll just be this warm body syndrome, we'll just get the next person we can because we're so desperate, but we can really try hone in on who's the right person for that position, who's going to culturally fit in your organization, and then help them grow within your organization. So we don't just stop when the individual is hired, but we actually keep working with them while they're in the position to keep them there, to improve the retention and help them grow.
Yeah, and I think that was what got me excited about that. It's not, again, moving from transaction to full engagement, moving from being, we're just going to provide a staff member and good luck, or we're going to provide a palette of candidates. You pick the ones you want. That was the thing. One of the things I got so excited about is this idea of like, we're going to put people in, we're going to stick with you through that process to make sure that they're growing, make sure they're making an impact. And that's the exact same approach that we have taken on the executive search side. That's where it has the biggest impact. Avi, I'd love for you to talk a little bit about kind of how you see the market right now, and why this, again, build on what Dr. Ringo just talked about, because this is the part that I think people need to listen to and they're not paying attention to sometimes in the marketplace, is this idea of like, we need help, we need help. But what can we do once we get that help to keep them engaged, keep them growing and making the impact that they should? What are your thoughts on that, Avi?
So it's fascinating, Mary. I think we actually started this discussion in the middle of COVID, if you recall, when the desperate search for nurses especially was going on. And at that point, I believe nurses were actually paid more than physicians because the nurse burnout situation was so terrible. And that hasn't changed to a large extent. Obviously, the salaries have changed significantly, but the issue of burnout within the healthcare system is so prevalent right now that it's really challenging to keep good people and to keep them engaged. And what we see in the ongoing relationships with our customers, with our clients, is the need to help them, the staff, the management staff, understand the real day-to-day challenges that these clinicians, whether they're NPs, PAs, MDs, MAs, whoever is patient-facing, they're dealing with real challenges on a minute-to-minute basis beyond just the scope of their actual job. So how do you find opportunities to help smooth over some of those challenges? How do you find ways to understand what they're facing and be able to at least talk them through, keep them engaged in the relationship? The second they feel burnt out, the second they feel forgotten, that's the second they start looking for their next job. And if we're able to really work within the framework of that team to help understand before you get to the stage of my head is gone already because I can't do this anymore, how do we figure out the best way to retain a long-term person who's a good person, who fits our culture, who knows what they're doing? What little things can we do? It's not usually going to be salary. So what little things can we do to keep them better engaged, to keep them more comfortable, and to keep them staying in the workplace where we really need them? As you know better than me, replacing any one of these staff members is so much more expensive than maintaining them. The retention is so important today.
Absolutely.
Yeah, the retention in that space is critically important. One of the things we're working on with Info Executives is training for leaders and around a gratitude framework called the Authentic Gratitude Communication Framework. And it's one of the focuses of the work with that framework is to improve patient satisfaction. And through gratitude expression, teaching team members to really be grateful at how they serve, et cetera. But we've been looking at a lot of the data that's related to turnover, burnout, et cetera, because that's another part of what we're trying to address. So to your point, Avi, is there's this effect when we have this high turnover that not only affects financially the organization, but also patient satisfaction scores drop because the new staff people are coming in all the time. It's not that the patient has an experience where they're seeing a bunch of new people because they're not there. In long-term care space, it might be the case where they see the same staff and don't see the same staff. That relationship changes. But even in the acute environment, what we've read, there's enough studies out there, and you can go out there and find those studies, is that if there's high turnover, there's also typically low patient satisfaction scores. So when healthcare organizations are looking at retention, sometimes they leave that as the domain of human resources or organizational development, et cetera. But there's a direct connection between turnover and patient satisfaction that people are missing. So I love the fact that you're focused on that. And by the way, checking in, and if you're watching live or if you watch the replay, we check the comments. We want to know you're out there. Please post in the comments. Let us know you're there. And if you have questions for Dr. Ringo and Avi, please post them in the comments, even after the show if you watch the replay. That's the whole goal here. But Sarah Ellis is checking in from Abu Dhabi. Thank you. And she says, thank you for hosting CalleoHealth. Dr. Ringo,
Marion, exactly to your point.
Yep.
as you talk about culture, right? So one of the things that we really look at is the culture starting at the top has to be passed along throughout the different levels of the staff. And exactly to your point, when you have turnover, a charge nurse or a chief nursing officer could try to implement whatever rules and regulations they want. But if there's constant turnover, they're constantly having to reteach. That leads to just additional frustration. So often that middle management position, that charge nurse, has such an impact, whether it's on a new nurse coming in straight from nursing school or even on an experienced nurse, in creating an environment so you can see sometimes even more turnover in one department, less in another, and you start looking and trying to understand what was going on, where your particular nurse was placed in which department. That middle management position takes that key from the senior management. If they know how to implement it well, it makes a huge difference in that retention opportunity.
Yeah, I think, and thank you for sharing that, because I this is the point of also the point of our relationship, is because we want to make sure the right senior people are in place too. Like, if there's an organization out there that's like, we got problems all the way from top to bottom or middle, wherever it is, that's part of that part of what the problem we're trying to solve. Dr. Ringo, I want to come back to you for a moment. When you look at these challenges from a provider, you've been a provider and you've ran provider organizations and at the highest level as a physician, what are some of the things that would be really important to physician and physician leaders about having an organization like this partnership, CalleoHealth and Inflow Executives, that would make a difference for them in terms of the type of team that are being put together, et cetera? I'd love for your perspective, because you've been in the trenches, you've been at the front line as a physician leader. I'd love to hear your insights on that as well, because I think that's part of what we're really trying to solve here.
Absolutely, and I think your last comment is key to this. You say we're trying to solve here. Physicians are really trying to help their patients solve a clinical problem, identify what's causing the challenge, what's causing the issue, and then come up with a diagnosis and treatment plan. And one of the many things that you learn in residency and medical school is that you don't do this alone. It takes a complete team. That when you're working in the hospital, your whole team is helping you, whether it's the nursing team, respiratory therapy, pharmacy, running a hospital. It's all the same piece, that no one can do this alone. Every single thing is a real team sport. This team that's working together and a team that's focused on the same goal. And when you are working in that clinical environment, trying to take care of your patient, and you know that everyone on the team is standing there with you, and they have the same goal and the same expectations, then that makes what you're trying to do so much easier, but that makes it much better care for the patient as well. And I think that's something that we really try to focus on, is we want to bring partners and new employees for that organization who are going to continue working alongside that team, who are going to follow the culture, follow the aims, and really be there for them. That it's not just another person, but it's someone who's the absolute the right fit. Because just the same thing with medication. If you give the wrong medication, it's not going to work. You're going to develop antibodies and react against it. You bring in someone in the workforce, in the workplace, who's not the right fit, you're going to do the same thing. So we put a lot of thought, not just into the individual candidates, but into processes for screening them, for making sure they're there. And once they're in, making sure that they continue to be a right fit and working right alongside them. And that's a significant benefit for anyone in that organization who's providing care, because you know that everyone who's with you is on the same team and has the same goals.
Yeah, thank you for that answer. Gina Tipton is checking in from Gray, Georgia. Gina is a hospital executive and nursing leader and a whole bunch of different things. So she definitely has insights. Gina, thanks for being in the audience. Avi, I'd love for you to share with the audience a little bit about kind of what's the recruiting process look like for you guys. Because one of the things I also got excited about that you share with me is, from your delivery time is typically shorter, you can move very quickly when it comes to that frontline staff, et cetera. And we'll talk about executive search in a moment, but love for you to talk about kind of What's that differentiator for you guys, and why that? And because it made me get excited because I've been around. Let me just be clear. I've been around the staffing world for a very, very long time. I started out in 1991 doing recruiting, and my first search was a ICU manager, and that's how I got my career started. So I'm very familiar with that process. But the quality of delivery, to Dr. Ringo's point about the match and understanding all that's critically important. But also now in 2026, and particularly going into 2027, the time it takes is also so critical. Talk about that if you don't mind.
So the first step, honestly, maybe the most important step, and you mentioned this earlier, Marion, is that relationship. It's really starting the conversation beyond just the paper of that job description. The JD is important, but it gives you so much information. It starts really with an in-depth conversation of understanding the culture of the organization, of the system, what they're looking for, what type of personality, what their values are. Because that helps guide really the interview process once you start that interview process. Once we get a better sense of what they're looking for, then obviously the search is on. And historically, if you look at the numbers, more often than not, a person will submit their resume for a job and they may hear back 14, 20, 23, 24 days later, and they've already forgotten what job they've applied for. We try to be in touch with the person, typically the same day, if not within 2 days for sure of when they submit their resume. We will have that conversation. We'll have that. The first conversation, obviously, is the technical information, making sure they fit the needs. But the next level of conversation really goes to understanding the culture of the person, how they're going to or not going to fit. We're able to explain to them what the system is looking for, and then be able to ask the appropriate questions to make sure that the fit is right before sending them on for that interview within the actual system. Beyond that, of course, we have a whole suite of opportunities that we can offer to a system if they want, from drug testing all the way through some of the onboarding processes. That depends on who the customer is, what their interests are. But in general, the most important thing is really trying to understand culturally what the needs are, and then as quickly as we can, getting that word out, getting right immediately in touch with the prospective candidate, and filtering it out as fast as we can.
Yeah, I think that's such a game changer. I mean, and again, it's moving that relationship from transactional, which we talked about, to collaborative, working with them, working with the organization. And one of the reasons that I got excited too, again, I keep talking about all the reasons I got excited about this relationship, but that's the way we work at Inflow Executives. It's all about first understanding that organization, not just from the top down, but what is it like? What is the core values? Who are they serving? I mean, one of the things, I know you guys work all over the country, and I work, even though I have this North Carolina accent, of Georgia, and our company's based here in Nashville, Atlanta, Nashville. We do work all over the country, understanding the different nuances of what the workforces are like in the different markets and the cultures. Those are critically important. Dr. Ringo, I would love for you to maybe share with us too, is why having your level, having that clinical understanding, the clinical operations understanding, having that, being an executive in a hospital, running a big program like you've ran, how that's influenced how CalleoHealth has come to market and what y'all do, because I think that is also, not many of the firms that we compete with had that kind of leadership. So I'd love to hear a little bit about your thoughts in that regard.
Sure. So, when we set out to design this program, the lens through which we looked at it was, if we were sitting at the other side of the table, or when we were sitting at the other side of the table, what would we want to see? What made a difference for us? What were some of our challenges? So every single piece that we built into it was to answer one of those questions. If I'm a hospital leader, if I'm a healthcare executive, having a challenge or trying to improve the way that I hire individuals, what were the gaps in the marketplace? What would really speak to me? And so that's exactly how we designed our program. As I said, it's not just someone who's going to look at this as a short-term commitment or a short-term relationship, hire the candidate and move on, but someone who's going to really get involved in your organization, meet with the HR team, get to know what they look for, make sure that after you've hired someone, there's a feedback to the hiring manager on an ongoing basis. If the candidate or now the new employee has challenges, address them with a hiring manager, feed that back to the employee. So really keeping that 360-degree loop going, not just prior to hiring, but post-hiring as well. So that is something that we really, really, focus on and look at. And then it's when in the interview phase or in the evaluation phase of the candidate, what are the key success factors that are going to make them succeed in their new role at this organization? What is the culture of the organization? What is the leadership structure of the organization? What are the advancement opportunities in the organization? So looking at all those factors to make sure that it's the right cultural fit, that it's an employee that's going to succeed and thrive in the new organization, and making sure that any small issues are addressed straight away and they don't fester, but keep that employee there.
Yeah, I totally agree with you. And I think when as a collective, we work with organizations and we stress that is so important. So thank you for that. Gina has got a great comment here. And I think this speaks to the core of what Avi, you and I and Dr. Ringo are trying to achieve with the organizations, relationships, et cetera, in the marketplace. She says it is the employees that make the difference for the patients. It's those people. I mean, obviously the clinicians provide the structure and the leadership, the physicians, obviously the PAs, the nurses, et cetera. But ultimately, just in the grand scheme of things, it's those group of employees that make the experience of the patients one way or the other. And the staff, all of those people deserve the best from our companies, from our leadership, et cetera. Gina, I think that comment, it really is on point. Thank you for sharing that.
And Marion, I think to that point, sadly, unfortunately, given the situation where you're dealing with people who are sick, sometimes end of life, they're getting the worst of the patient. They're not seeing the patient at their best. They're dealing with constant, unintentional, but constant abuse and pressure from the patient, from the families. And we expect them to respond with a smile. We expect them to respond professionally and respectfully. And it's such a challenging ask. And if you don't have the right team in place, you don't have the right corporate culture, in quotes, that culture within that team, it is so difficult to be able to really provide the most important services anybody is going to get with that smile, with that respect. And it's so important that the team is able to build that culture to make it an environment where people can thrive. But it's a huge challenge, as we all know.
Yeah, absolutely. Well, I think I told y'all on the pre-show, I may have not, but I always tell everybody in the pre-show that the 30 minutes that we're on air goes by just like that for some reason. I have no idea how that 30 minutes turns into what feels like 10. But final comment, Dr. Ringo, and we'll post in the comments how you can get in touch with each of us. Final comments. Any other comments from you and why you're glad to be part of our relationship? Any comments from I think I've shared my heart on this a little bit. Love to hear that. And Avi, if you want to wrap us up after that. Thank you for watching the show and thank you for being in the audience, either from the replay or the live. Dr. Ringo.
Sure. Thank you very much. It's as you said, we're really excited about this, the two organizations coming together and now being an opportunity when meeting with any healthcare organization to really solve their staffing and other issues, from top to bottom across the spectrum of the organization. And working with people who share our values and commitment to bringing those people there is something that's really exciting for us, and excited about the opportunity and looking forward to it.
Yeah, thank you so much, Dr. Ringo. Avi.
Absolutely. I think, Marion, you and I started talking probably 6-7 years ago already. And one of the things that we always were very aligned upon is how we build the business, right? The business, whatever business is always built upon that relationship. And beyond the relationship you're building with your customer, with your client, is also really getting an in-depth understanding of what their needs are, and if we can add value, what that value is. When I look at the way we can function, and we do function together already, is understanding together, we complement each other. How do we get the best understanding of the culture of the organization? How do we best find the right people from the top all the way down to make a cohesive team? I think when you come in with a holistic solution where we're learning from you and you're learning from us, and we're able to complement each other in that hiring process, it goes beyond 1 + 1 = 2. We're going to 2.5, 3, because we just improve upon each other together. for the hospital system and ultimately for the patients.
And that's a great way to wrap it up. Thank you all for watching this special edition of the Healthcare Leadership Show. Connect with us on LinkedIn if you're not already connected. Connect with everyone on the screen, and have a great day. Look for other episodes and look for more information on LinkedIn about the CalleoHealth Inflow Executives relationship and why it matters and why it will matter for you. Have a great day. Thank y'all for being on the show.
Thanks for having us.
you.
Appreciate the opportunity. Thank you.
Absolutely.